Hi, Maria.
Hi, Alicia.
How did it feel to do the screening?
It felt great. I just, being it's the first appointment at this clinic, I just don't want to be, overly pushy. I am the point of entry and, in starting to build that trust with us for the patient to be able to open up to the provider. So it is a little nerve-wracking to make sure, that I don't say anything that might cause the patient not to open up or, to be hesitant to answer to the questionnaire.
You were very receptive to his question of what is this for and how will it be used?
I feel like the more information we know about why, the reasoning behind why we're doing these questionnaires, kind of alleviates that nervousness or that stress of, oh, this is another questionnaire. These are another set of, questions that I need to answer. But just knowing the purpose of, why we need to get this done, and just bringing it back to, we just want to make sure that we take care of your overall health. That importance alleviates a little bit of, those sensations for patients to be able to cooperate and understand.
And I noticed that, Maria, you really brought a sense of conviction to the tone of voice that you had when you described the reason for the screening. It was like you really believed in the legitimacy of asking these questions. And you reiterated that when he pushed back a little.
Absolutely.
Yes. So you conveyed a sense of we're doing this for a reason.
Mm-hmm.
Yes. The other thing that I really liked is the way you explained that difficult experience, adverse experience can have an effect, but it's not necessarily predetermined that they will have an effect. So you softened the possibility of a connection, but you made it very real and very clear.
Yes. And especially when patients are a little hesitant too, I just, want them to be at ease and make sure that this is completely confidential and not to be shared with anyone. Once again, to just build that trust and allow them to either open up with the provider, either at that point or at, any other follow-up visits.
Yes, that really is the theme of everything you said. And I am just also thinking of your saying that you are the port of entry.
Mm-hmm.
So his experience with you is going to color his experience with the provider and his experience of the clinic.
Right.
So it sounds
Absolutely.
as if you were very aware of that
Yes.
and really making sure that you gave him a good, solid experience. Maria, I also noticed the way you responded when he asked, what are you going to do with these questions? I noticed that you emphasized that the answers are confidential and that the provider will continue addressing the questions that he might have. What was your reasoning for answering that way?
It just provides a clear point that I'm just there to provide the questionnaire and that the provider is there to fully help the patient if there are any resources or if they do open up to be able to, help them and know, depending on what they open up with, in connecting them with the resources that are available. At our clinic, that's how we do it. Because we don't want to, we want to make sure that it's very clear what our rules are so that if the patient opens up to me and gives me an answer that I don't know how to handle, I don't want the patient to think that we're not capable of helping them and breaking that trust with them, that they don't open up to the provider or to whoever they go back to see and show them that we're able to help them. It's just a very vulnerable state that we want to try to avoid for the patient's sake, because we don't know, what they're carrying on their shoulders. We don't know what their adverse experiences have been during their childhood. And we just want to make sure that the correct that the correct provider, the correct person is able to handle that information in a correct way that'll allow patients to be able to continue opening up so that we're able to continue offering them the resources that we have and have them have a good, healthy lifestyle.
I understand. So what you are saying is that you were describing for him that there is a clear role allocation and that your role is to introduce him to the screening, and that the role of the provider is to look at the answers and go into greater detail with
Absolutely.
him about the
Yes.
meaning of the answers. Thank you.
We want to make sure that we are able to, build that trust with them in answering, clear, very, short answers about the questionnaire specifically, and anything else related to the questionnaire that the provider is able to go over that with them.
I see. I understand. Thank you very much.